I am Dr. Nageshwar Reddy. I am Chairman, AIG Hospitals. I am a consultant gastroenterologist working here.
I am Dr. Hardik Rughwani, a consultant gastroenterologist at the AIG Hospitals, Hyderabad, India. Today we are going to discuss our study, carbon footprinting and environmental impact of GI endoscopy procedures at a tertiary care institute, a multidimensional assessment which was published in Gut recently.
Hardik, this is a very interesting study that you published. What inspired you to do this study?
As a physician and as a gastroenterologist, we have noticed that we care for our patients, but along with that, we need to know how much our endoscopy procedures have an effect on the planet and environment in general. So as a result, we decided to quantify the carbon footprinting that these procedures generate. Overall, the studies done previously have shown that the healthcare contributes to 4.4% of the greenhouse gas emissions in the world, and GI endoscopy contributes to the third largest hazard producing materials in the hospital. So as a team, we decided to quantify the carbon emissions and that led to the study.
So can you explain me these terms of carbon footprint, green endoscopy concept and all?
The green endoscopy is the application of environmental sustainable processes that involves reduction of the carbon emission, reduction of the waste generated, and to make the endoscopy processes more sustainable along with proper patient care and safety. And the carbon footprinting involves a process in which we do the calculations of the carbon emissions, mainly the carbon dioxide and the methane gas produced during these procedures.
And how much carbon equivalent of each of these? For example, methane has got a large carbon equivalent.
Yes.
So that's how you calculate carbon. I think that's a great concept. In your study protocol with a multi-dimensional approach to calculations, how did you do it?
So our study protocol, it involved a 2-week study of around 4,000 endoscopy procedures which were done at the AIG hospitals. And in that, we collected data from electricity consumption, water consumption, the waste generated out of these procedures, the patient travel along with the transportation of endoscopes and accessories, and also the consumables that includes the medical gases and the instruments that are used. We use the GHG protocol. They are international standards for measuring the carbon emission. And along with that, we also saw the waste disposable methods, which usually are in the form of direct landfilling, incineration followed by landfilling, and then also recycling. And we quantified them accordingly.
And what were the key findings of your study?
So the key findings of our study are, we have seen that the electricity consumption is around 5 kilowatt per hour per procedure. The water consumption is almost around 70 liters per procedure. The waste generated is around 2,000 kilograms in 2 weeks, which comes to around half kg per procedure. Along with that, the carbon emission comes to around 38 kg CO2, which is around, if we exclude the patient travel, it's around 6 kg CO2. And if we look at the carbon footprinting, the highest emission is because of patient travel, followed by electricity consumption, medical gases usage, and water consumption. We have also seen in our study, so the diagnostic procedures are producing less emissions compared to the therapeutic procedures. Also, one thing we have noted, which is important, is the waste disposable management. We have done 10% of our waste which goes to the landfill. Around 65% of our waste goes to incineration followed by landfill, and around 25% of our waste goes for recycling, which is an important added factor that we have
found. So how does your finding differ from Western data? We have some Western data now.
Yeah, so there have been studies from 2 studies from the US and 1 study from the France, and this is the first study from Asia that has shown that the amount of waste generated per procedure in the Western countries is around 2 to 3 kilograms, which for us is around half gram. Majority of their waste goes for landfill, and although it is recyclable, the process of recycling doesn't occur much. For us, the amount of landfill disposal is around 10%, with around 25% materials being recycled. So that has an added advantage in which we are per year, saving almost around 10,000 kg CO2 of emissions. Also, we have seen that the total emissions in US and in European countries is around 15 kg CO2, which for us is around 6.5 kg CO2.
Much less.
So it's half of it.
Yeah. So, and I think looking at it, looks like what you're suggesting is that endoscopy is significant contribution to carbon footprint, therapeutic endoscopy more than diagnostic endoscopy, and travel of people coming for endoscopy seems to be a major factor in addition to others. Okay, then what are the limitations of your study, Hardik?
So there are certain limitations, like if we look at the process of carbon footprinting, it involves mainly three processes. First is the production, second is the transportation, and the third is the consumption.
Okay.
So the entire life cycle assessment of instruments and the endoscopes we were not able to do because of certain limitations, which we can do if and in future it can be planned. We have compared the diagnostic and the therapeutic procedures, but further subgroup analysis of therapeutic procedures needs to be done. Because all these processes are resource intensive and it requires further data. These are some of the limitations of our study.
So, and how do you think this affects the future research and policy making also?
Yes, so because of this study, we have been able to find out the places where we can act and help to make the endoscopy and environment in general better. So, first thing is that India being a bigger country, the travel emissions are the largest that have led to the carbon footprinting. So what we recommend is sustainable transportation options like air biofuel. We need proper e-vehicles that will help in the transportation, especially buses. Telemedicine plays a very important role. Also strengthening the community health services with referrals of patients who require endoscopy should be done. And proper research with the companies playing an important role in developing more instruments with R&D that help in reduction of water and electricity in these instruments will be useful.
Okay. So, are you saying that we should stop doing endoscopy completely, or is there an alternative?
So, there is a misconception that if we tell that the endoscopy is causing emissions, then we are telling that we don't do endoscopy, but that's a wrong concept. We are actually telling that endoscopy is an indispensable medical tool in today's world. India needs it because it is an important tool to manage pancreatobiliary diseases, to detect and treat early gastric cancers, and to remove polyps and stop bleeding. So we can't do without endoscopy. We are telling to make endoscopy more smarter, more sustainable, and more green. So to conclude, we will like to give certain recommendations for the healthier future of our patients and the planet. Efficient electricity and water management, adoption of eco-conscious healthcare practices, sustainability initiatives by the hospitals, balancing excellence with environmental stewardship, and embracing AI in healthcare operations for judicious use of resources.
So, thank you very much, Hardik. I think that was a fantastic study, and it's clarified many of the things that we thought earlier. Certainly, endoscopy is needed in most of our patients because this is essential for diagnosis, and many therapeutic procedures are done. But I think we should do it in a more sustainable fashion, and this study brings out the fact that there are certain areas we can improve on so that we can make it more eco-friendly. Thank you.
Thank you very much. And we can make it more sustainable. If every human per year grows a tree, then
so that's
it will
a good
help
message
to the environment overall.
Thank you. Thank you, Hardik.